joined us in the last couple of minutes. We're going to give maybe another minute or two for people to join and get logged on the WebEx, but as a housekeeping item, oh, Sarah, there's a comment in the chat box that the link on the Medicaid page is old. It goes to September's WebEx.
Ooh, lovely.
Okay, is that something that you can email our website folks about and see if they can get that updated? Thank you, Denise, for letting us know. Hopefully we can get that corrected within the next couple of minutes. So, and normally they're able to instantly update that web page. So knowing that we've got a technical issue, inevitably, as soon as I said we'd gotten it down to a science, we'll give folks a few more minutes to join, knowing that we'll have some people joining in a couple minutes. And Sarah, will you let me know when you've been able to get in touch with the communications team about the webpage?
Yes, I can.
Okay. And just so that you're aware, and I went out and I clicked on the link as well. Let me pull this up here. This is what it says. Meeting has been canceled or ended. And that's from following this link.
Okay.
Okay. Sorry about that, folks.
Thank you.
Okay, well, while Sarah is working on getting our external page updated, I'll go ahead and get started. So good morning, my name is Ali Fernandez. I'm with the Bureau of Long-Term Care, and I'm one of the sponsors for the Electronic Visit Verification, or EVV project for Idaho Medicaid. Joining me here in person is Katie Davis, also from the Bureau of Long-Term Care. And some of you are probably pretty familiar with Katie as the facilitator of some of our sub-work group meetings. And as you likely can see, we've turned on our webcams for this presentation. One of the lessons that we learned from some of our other big projects and implementations is it's very nice to match a face with a name from time to time. And there's a lot that you glean from body language. In addition, I'm told that I talk with my hands, so hopefully you get the full effect of the presentation by being able to see us. Just so that you are aware, again, as I've mentioned, your line is muted when you join the call. We do that to preserve the call quality so that we don't have background noise, but do please feel free to use the chat feature. You're welcome to throw questions or comments in there throughout the presentation, and I'll periodically kind of peek over to see if there's any new content. You can get to the chat feature by hovering your mouse on a computer, or if you're on a mobile device, tapping on the bottom of the WebEx application screen to get the menu. You can click on the chat bubble to open up that separate chat box. This is a little bit of a different format for our presentations. Our Public Information Office has developed these really nice templates for us to use. So it looks a little bit different, but the content you'll see is largely the same. So for all of our presentations, we do provide a refresher overview, just in case this is the first time you are joining one of our meetings, so that you have a good kind of orientation to the project if you have not had an opportunity to join us before. So by way of very quick overview, an electronic visit verification, or EVV system, is a system that captures information about a visit made to a member's home. Today, there are a variety of EVV software solutions out on the market, including GPS, smartphone, and cloud-based, etc. When telephony first started, I think the early 90s, primarily landline-based. But as you can surmise, a lot of folks don't have landlines anymore. And so as technology evolved, so then have EVV systems. The regulatory background for this project is that the EVV mandate was a small part of a very large bundle of regulations passed in 2016. That bundle of regulations is the 21st Century Cures Act. And we do have, I believe, out on the project webpage, which is evv.bhw.idaho.gov. We've got a link to the full package there if you are interested in some light reading material. Specifically section 12006 that includes the language around the EVV system. And the language in the regulations is deceptively simple. Essentially, it includes that the state has to require that providers of personal care services and home health services mandate that their service providers use EVV systems by specific deadlines. So for the personal care services group, that deadline is January 1st, 2020. For home health services, the deadline is January 1st of 2023. And there are fiscal penalties associated with non-compliance. And as I said in previous meetings, but we'll say again, that if we were to incur that penalty, we will not pass that on to providers. That will be a penalty incurred by the state. Except today we do have some good news on that topic, so more to come. So as far as where we are at in our project, and those of you that have been joining the project updates since, I think our first one was last December when we had our kickoff, we've kind of moved in starts and stops depending on the surrounding environment. And so as we have gone along, we have updated our implementation tasks and schedule kind of depending on the nature of what's been occurring. So as of right now, we are still planning on dedicating this winter to primarily our sub-stakeholder work groups. So those are all our smaller, more intensive groups that are very outcome and deliverable oriented. This larger stakeholder group is primarily just sharing updates, answering questions, hearing from concerns. And I do see from the chat box that the link on our webpage has been updated. So again, thank you very much, Denise, for letting us know about that. And I do see more folks that are calling in. So excellent, and thanks for letting us know. And I'm sorry about that technical difficulty. So for winter, we're primarily focused on those small work groups that will start getting into the nuts and bolts of implementation. And Katie, in a moment, will talk a little bit more specifically about what's been going on in those work groups over the last couple of months. Another big component for the state is the rulemaking process. So we will have to pursue changes to Idaho Administrative Code, or IDAPA. And those of you that are oriented to that rulemaking process, you know that it's pretty long. It's got a number of steps. Some are formal, some are informal, but we have to accommodate that process within our project timeline. And then on the kind of internal side, so our Division of Medicaid-facing activities, we have to start requirements gathering for our aggregator. And what I mean by requirements gathering is essentially taking the feedback that we've gleaned from our providers, from members, from the community at large about, things to keep in mind as we move forward with this implementation, some of the logistical barriers that providers are going to face in adopting and implementing these systems, et cetera. How are we going to build our aggregator? And so the business requirements component is, really getting into the weeds on what do we want this system to do for us? How do we want this to look, smell, and feel? As we move into the spring and summer of next year, we are looking at launching. So we hope to, by then, have selected and moved forward with building and launching our aggregator system. And providers will also start adopting their own compliance systems. As part of that, of course, we have to build in some training timeframes for our relevant stakeholder groups. And so that likely will include, training for, participants, people that are having to input information into those systems, as well as providers as they first adopt their EVV solutions and then have to engage with our aggregator system. We're also looking at our rules going live as temporary rules on July 1st of next year. Another couple of big updates for the project for this month. We have selected an open model. So you may remember from our last update that the project team had recommended an open model, and we were waiting on some final executive level decisions from Medicaid administration. And that has been approved with some controls in place. And so the feedback that we received from Medicaid administration is that we want to make sure we proceed in a way that we set up some bumpers. And the analogy that someone came up with was, well, what are we going to do if some company, they build an EVV platform in their garage and they start selling it to providers as a compliant system? How are we going to control that and prevent that from happening? And so those are the kinds of bumpers that we're talking about. And so an example might be we include a provision in our rules that whatever system providers adopt has to pass a successful file transmission to the state's aggregator before we would consider it a compliant system. Some other ideas that we had tossed around that need vetting through our sub-stakeholder work groups include potentially having a list. These are the known solutions out there with compatibility with the system that we have as our aggregator. That's another way that we could, again, put up a safety net around which systems providers are adopting. And as I mentioned, that does need to be vetted through our sub-work groups. And so that will, if it has not already come up as part of the policy and operations work group, we have to visit that during our rules work group that will be starting soon. Another update, and we did provide a little bit of information on this at our last meeting, but we will be using a company called SANdata as our aggregator pending legislative approval of our budget. So SANdata is the aggregator solution that our current MMIS vendor, DXC Technology, uses. And so as you may recall, we had to spend quite a bit of time working on determining through our division or department, I think division of purchasing, to determine if we would have to go out with a request for proposal in order to procure that system, in which case we would be pretty heavily modifying our timeline because those take up to 18 months. Sorry, I saw a question in the chat box, and I will get to that in just a moment because that is an excellent question. And as it turns out, the feedback we ultimately received was because the aggregator's function and activity fits within the scope of the current contract with our MMIS vendor, we do not have to go out to a request for proposal. So our plan is to proceed with SANdata. We will start working on our kind of requirements gathering internally to start fleshing out exactly what we want that to look like before we begin engaging with SANdata to build the system. Another point worth noting, as I am sure there are folks on the call that are aware of this, but in the last, I believe this has now been a few months, that Governor Little did direct state of Idaho agencies to reduce their spending in the current fiscal year by 1% is the target goal. And so Medicaid, as with our other divisions within health and welfare, has been evaluating the ways in which we are going to accomplish that. And understandably, people get very nervous when, when there's talks about reducing, your spending, et cetera, But I'm very pleased to share that this particular budget request is still proceeding. Now, that being said, it is, again, subject to legislative approval as final approval, but we have still included it as part of our request for the 2021 state fiscal year that starts next July 1st. So I do want to shift to the question that was posted in the chat box. So when will the rules for a third-party EVV vendor be posted? Unknown. So it is our intention as part of one of our work groups to develop those minimum criteria and be able to share those with providers. However, one of our biggest limitations at this time is that because the legislative funding is uncertain, we're navigating an interesting space of we want to get as much work done as humanly possible before then. so that we're ready to hit the ground running as soon as funding is approved. So as far as when we will have that information available, I'm not certain. But that's a good question. Sarah, our project manager, is also on the line, and I think Susan Shire, who's also on our project team, Jennifer Pinker on our project team. So if you could take that down, because that is a good detail for an FAQ. We're also in the process, or just shy of posting a set of frequently asked questions. So we'll include some conversation on that at this time. So our next update is on our good faith effort submission. So you'll recall in the first couple of slides that the good faith effort is the state's request to CMS to exempt us from incurring the penalty in calendar year 2020. So we submitted the request on September 5th, and hooray, they approved our request on November 5th. So that request in its entirety is posted out on our webpage for your review. But CMS did approve that, so that means for calendar year 2020, we will not incur a penalty while we are still working to implement our EVV rules, aggregator, and then providers adopting their systems. There was a follow-up question in the chat box about if a provider chooses an EVV vendor before the rules are posted, then what happens? So I've said this before and I'll say it again. Our desire is never to impose an onerous administrative requirement for providers. So what we have heard from providers is a lot of entities, especially provider agencies that work in multiple states, they've already gone out and made the investment, which is a big reason behind us adopting the open model, is we don't want providers to go out and purchase software and then have to do something completely different. So in all likelihood, what we will have to consider is building in a process for testing those vendors. So for example, let's say that we have our list of 8 vendors that we know are compatible, but perhaps your agency has bought, ABC EVV, and that is an untested system. We would need to build in a process for the provider to be able to test that system's compatibility with the aggregator. If we cannot reach compatibility, that's kind of a scorched earth scenario that we'd have to figure out exactly how we navigate that. But what we have encouraged providers to do in their own vetting of solutions is, has your company implemented in other states? Has it been found to be compliant with the EVV requirements? Does it capture and validate all 6 required data elements of the EVV system? So there are some questions that you can be asking in anticipation of that would put you in a pretty good position prior to our launch of that aggregator. But we will have to build in some, what if scenario processes to account for those. So that's a good question. And we are also, as part of our FAQs, going to incorporate some of that, or what do providers need to be thinking about right now? What are the things that they will have to think about in the future? We want to make this as least painful as possible. Okay, so updates on our stakeholder work groups. I will turn it over to Katie for a little while to talk about the stakeholder work groups. Unfortunately, I've not had the pleasure of joining those. Normally I'm very nerdy. I like going to those kinds of work groups, but I haven't had an opportunity. But Katie has been facilitating. So Katie, if you want to take it over, and I can drive for you.
Yeah, sounds great. So we have 3 work groups in total, and 2 of them have been initiated so far. So we have our policy and operations work group going, and we just launched our implementation work group last week. So just that reminder, for our personal assistance agency providers, we are going to run a separate work group through the Bureau of Long-Term Care to look at those service plan and progress note rules, because we have some things in there currently that may not quite align as well with EVV, or that could become obsolete. It could be a bit redundant with those. So we want to have a conversation of what can we remove, what makes sense, and run that separate from the EVV work groups as well. And then that reminder that we are going to run the items that come out of those smaller work groups through this platform here. So we'll have those updates on our stakeholder meetings like this one. We'll put those on the EVV website, and we'll do an email blast out to providers, that may not be able to join us on these items, just so everyone has an opportunity to look at the content that's coming out of those groups and to also have an opportunity to provide some feedback of, kind of thoughts, concerns, if you like it, if you don't, and provide some suggestions through that as well. So more specifically with the policy and operations work group, we had our kickoff meeting in October, and we came to a group consensus that we wanted to meet on a bi-weekly basis. I think it's actually on Wednesdays. I have the wrong date on there. Sorry. Nonetheless, we meet bi-weekly as a group. There's a total of 10 people on that work group outside of the project team. So we did a combination of our different provider types, our personal assistance agencies, home health agencies. We were able to find a few participants that were interested in being on the work group. We have a representative from one of our centers for independent living and some advocacy representation as well. So with that, we solicited some feedback for a while. We did that key survey earlier in the spring, to say, hey, is anyone interested in a work group? We've asked, through these meetings, if you're interested, to let us know. Compiled all of that and did our best to try to get a good variety of, representation and then representing other areas of the state. So we have, providers from Coeur d'Alene, St. Mary's over to Salmon. And in between, we have participants, some that have been using kind of a form of EVV with their providers, some that have not, some people that have implemented, some people that haven't, and then the variety of size of, we have some small agencies and bigger agencies. So we really wanted to get a good mix of people to really get a well-rounded perspective of kind of where we're at, where we're headed, and to have those considerations from a variety of different representatives. So our current pending items with that work group are establishing that minimum EVV criteria if we wanted to go kind of above and beyond that, or if we would like to stay with what the Cures Act is requiring at this time. We're also having a conversation about claims adjudication. So if we'd like to utilize any of our electronic visit verification data and have that kind of tie in with claims payments. And we're also working on that FAQ document to see if there's any kind of gaps we need to add. Because we do want it to be a document that can be utilized with providers, but through participants as well. And then our implementation work group. So just fresh, we had our kickoff meeting last week. It's a little bit smaller of a group with kind of, we now have 6 established representatives for that. We had a participant who also serves with an advocacy role as well that agreed to join us. So we have some personal assistance agencies, some home health agencies again, and then a participant that was interested in joining us. And with that group, kind of similar composition of a statewide representation, some bigger, some smaller agencies, some people that have or have not implemented EVV, and also feels like a pretty representative mix of that so far. So our current kind of priority tasks are working on those phases for implementation and establishing some milestones, working on a timeline and setting some specific target dates, and then creating some best practice documentation for providers and participants. So the current pending item we have with that group will meet for the, our first official kind of work group meeting next week to start talking about some of the questions that providers or participants could be asking vendors from the participant perspective, a bit more of, if I'm looking for a provider for my services, what kinds of questions would I maybe want to ask to know a little bit more about their system and how that works. So that's our starting point there. And, some of the group from policy and operations will impact implementation. So we're kind of running those together and we have them meeting on kind of opposite weeks so that if there are things that need to go back and forth, we can try to do that as effectively as possible.
And Katie and I were having a passing conversation yesterday on this topic of, what do we think is going to happen in particular with the implementation work group. And of the 3 work groups, this is likely the one that will have to run the longest, really out of necessity, because this implementation will be probably fussy, to say the least, that I expect it'll be very iterative. So we will likely start working on our business requirements for our aggregator, confer with our systems team, get feedback from our systems team. That will kind of bring up new topics that we need to ferret out with the stakeholder work group to get some, updated recommendations and suggestions on, to then take it back to our aggregator. And so I envision that being kind of an ongoing cycle as we work through the implementation process. And one of the big lessons learned from previous program implementations is, if we commit to a timeline, specific milestones, objectives, and do not plan to ever deviate from that, we often pigeonhole ourselves. And so we really want to allow ourselves the flexibility to make sure we can adapt to whatever challenges might crop up, whether those are challenges for us internally on the state side or challenges for providers in adopting their EVV platforms, or potentially like unknown or unforeseen barriers for participants and being able to adapt to using, a different way to verify their services. So we want to be sensitive to that. I was talking about the rules, I think.
Yeah, okay.
So the rules work group is the third and probably the most intense short work group of these. The reason being, we, as I mentioned, have a very prescriptive process at the state level for how we promulgate changes to Idaho Administrative Code, or IDAPA. So as part of our winter activities, we will be spending a lot of time sprinting on drafting up those rules. So there will be many opportunities for public input, both formal and informal. Right now, we're in the informal phase. So with the policy and operations work group, they are deriving kind of the bigger system-wide implications that people are providing feedback to then inform a first draft of our rules. What are the very basic requirements we want to write around EVV implementation and adoption? So as we work on those draft rules, we are hoping to have a pretty spit and polished draft done well before our formal negotiated rulemaking in April. So for our personal assistance agencies that are on the line, that's also our deadline or our target date, I should say, for if there are modifications we would like to make elsewhere to service plan or progress note requirements to align with the principle of EVV. That's where everything will intersect, is at that April formal negotiated rulemaking. So as a result of the now I'm tongue-tied. As the rules work group, one of the desired deliverables or products to be able to share with you is a first draft of those rules so that we can collect everybody's comments, hopefully check off some of the biggest concerns even before we get to the negotiated rulemaking. But if there are lingering issues, we can address those. The rules are intended to go into effect as temporary rules on July 1st. And I don't want that to cause any angst, which is why I've included a screenshot of a rule that we used some years ago with a similar very large implementation that we actually wrote in our runway to compliance. So even though the rules are effective, we had indicated, we will not begin taking enforcement actions based on this rule until some future date. So what we would like to do is have our rules go effective July 1st of 2020, and then write in our enforcement date of July 2021, or, potentially December 2021. I'm just throwing things out there. But that end date will be informed largely by the implementation work group's recommendation of timeline. And so hopefully you get an idea of how interdependent a lot of these decisions and steps in this project are. So as far as participant engagement, I did want to spend a moment to speak a little bit to this, because one of the requirements in the federal regulation is that the state has to engage, participants, family caregivers, providers, and other entities that access or have a vested interest in the system. And to date, we got a great response from participants on our survey. So we surveyed a sample of participants who are currently, using services from an agency that has adopted some type of EVV system. And as part of that, we asked, would you be interested in participating in a stakeholder work group or some level of engagement with members in the future? We had a pretty good response rate. And so now we're waiting for the right opportunity to get member feedback that might be different from some of those sub-work groups. So, one of our strategies is to ensure that the member perspective is present and included in all of those conversations. But like with previous projects, I suspect what we're going to find is as the project evolves, we're going to identify, now's an opportunity. Maybe it's our best practices guideline, and we send that out for review to members, or we have something like a small focus group to get a sense of, what's the readability? Did we miss information? Is this content understandable? So we have not forgotten about member engagement. It's fully on our task list. We just don't know exactly how that will look. So I just wanted to make sure folks are aware of that. So as far as the process flow for those work groups, we've talked a little bit about the principle of the groups, and Katie's talked about the desire to have those tangible outputs. There's a document. There's something that comes out of those groups. So the process for evaluating and reviewing those is that every recommendation will be considered by the project team. The project team will move forward those feasible recommendations to Medicaid administration, and we do have to get final approval from Medicaid administration. But our intention is to be completely transparent in that process. So when we do not move a recommendation forward, our obligation to you as our stakeholder is to walk through why not. Those products, again, like Katie mentioned, will be made available to stakeholders for input before we adopt anything in final. And I'm sorry to put you on the spot. Do we have an idea of when our first deliverable will be ready for folks?
I think we're hoping by the beginning of the year.
Okay. And
January.
I would guess January is going to be kind of a busy month for products put out there for folks. In all likelihood, what that will look like is an email blast that says, hey, everyone, this document, this best practice guideline, et cetera, is available out on our webpage, or here's a Word document. Please feel free to review, send comments back by X date so that we have a moment to compile those and then proceed, so that then at the next big stakeholder update like this, we can report back to you on the feedback that we got and what changes we did or did not adopt. So the parking lot, it's a good opportunity to talk about the parking lot because we, even in this larger stakeholder group, have had a lot of varying subjects come up that are kind of tangentially related to EVV, but not necessarily something that's within the scope of this project. And so the team has developed a formal parking lot of issues. And the parking lot serves a few different purposes. One, it's to put questions that we don't quite have an answer to yet. So the question that came up in the chat box about, when are those third-party EVV vendor rules going to be posted? We don't know the answer today, but that is a parking lot item because we need to respond to that. And that's one that when we get to it and the time is right, we will pluck that out of there to make sure that we capture that ongoing. We'll also have questions or issues or topics that are dependent upon other decisions. So one of the big milestones for us will be legislative approval of that budget. And so there are a lot of activities around the build of our aggregator that we cannot embark upon until we've got that legislative approval. So anything that comes up in our work group that would inform that work, we would have to put in the parking lot until we've got authority to proceed. And then it will also include, and it may be more of a cemetery than a parking lot in this instance, but topics that are out of scope. So one that has come up quite a bit is the concept of blended rates. And I mean, I don't mean to say that I don't think blended rates might be a good idea in certain systems, in certain types of circumstances. In the context of our implementation of EVV, when folks recommend blended rates, that is a much larger conversation and much more significant implications than our project team and what we're looking at implementing. And for those of you that have worked through, like the cost surveys for PCS agencies or assisted living facilities, et cetera, know that even a simple cost survey is very onerous, but to then also shift a reimbursement methodology and build, there are a lot of complexities for that. And so the blended rates conversation is something we do have to put in the parking lot permanently. However, that being said, I will say that in the context of blended rates, what we are gaining from that is a really clear understanding of what providers' concerns are for how are they going to be able to distinguish between individual service types, care tasks, and procedure codes when they're documenting. And then secondary to that, what are the implications for your claims? So it's been a productive conversation in terms of us getting a good understanding of what that means for you as providers. But as far as pursuing a blended rate as a way to make EVV adoption easier, that's not an option that is on the table for us at this time. So the next steps for the project, as I said, the project has gone in starts and stops. We are definitely heading into a sprint. We will be churning out a number of deliverables for your review, in addition to engaging in a lot of internal activity around rules within the next couple of months. So by first of the year, we should have at least a deliverable or two for your review. We will have those frequently asked questions ready. I think those are going through the review process at that next sub-work group meeting for their feedback before we publish it for this larger group. And then again, we have a lot of internal work that we need to get started on. And so our next larger stakeholder update like this is planned for February. And we'll double and triple check the link on the website to make sure that it goes to the correct version. So maybe our, seventh time is a charm for getting our technology to cooperate with us. But by the stakeholder update in February, we should have a lot of updates to provide. So we're hoping that the project will be gaining quite a bit of momentum by then. So by way of just information, make sure you do visit our webpage at evv.dhw.idaho.gov. Let's see, I do not see the slide deck for today's presentation posted just yet, but it should be shortly. So if you're looking for the slide deck, I would maybe visit the webpage later today or tomorrow morning. That will be available for you. In addition, you can email the project team at evv@dhw.idaho.gov if you have questions, thoughts, concerns. Perhaps if you're newly joining these and you might have an interest in participating in a work group. The charters, I think at least for the first two, have been drawn up, but please still let us know, because what we found is that we have some folks that they are interested, but then they can't, due to other obligations, and so we need to find others who would be willing to participate in those work groups, so please let us know. If we do get that box that we're not able to answer at this time, we'll let you know, but please ask, because that gives us an idea of content for our frequently asked questions document and for our parking lot of, if we can't answer this now, we may need to revisit it in the future. So I think that's the end of the presentation. In a moment, I'll go back to the previous slide so that you can take down our contact information. But if you have questions, you can ask them on the audio by unmuting your line by pressing *6. You also can use the chat feature to ask a question. I'll leave that slide up there for a moment. I know it usually takes folks a minute to, hammer out their question in the chat box, so we'll give it another few minutes.
Hello.
Hello.
Hi, my name's Amy, and I work for Stonebridge Home Care Solutions.
Yeah.
And I was just wondering, are you going to be emailing this presentation out?
We do not normally email the presentation out, knowing that we don't have a complete distribution list. But if you visit our webpage later this afternoon, it will be posted. Let me pull up the webpage too, so I can show you where it to go. So this is
I have a couple of people that I'll want to go over this with from the hospice side as well.
Perfect.
So I just want to make sure I have access to information.
Yep, absolutely. We'll get that posted here on the right-hand side under stakeholder presentations for the December 2019 update.
Perfect. Thank you.
Great. Thank you. And I do see a question in the chat box. Do you happen to know when you might hear from CMS about the self-direct exemption you asked for? Good question. So I believe at our last stakeholder update, we did say that we had requested technical assistance from CMS. Based on our analysis, we were excluding specific services. We have a meeting with Sarah. I'm not sure if it's this week or next week to talk to CMS on this subject. So hopefully soon. It's very rare that CMS will give us an answer verbally on the spot, so I don't expect that we'll have that call and they'll say, yeah, you're great, go forth and prosper. Usually they'll follow up in writing. So hopefully before the next stakeholder update, we will have a response from CMS that is formal and in writing, but not yet. And you are welcome. CMS is kind of like the state, you know, move at a snail's pace, so, or slow as molasses in January, but at least they responded within the same year. Great. Any other questions? And again, you can ask on the audio or use the chat feature. Bring up the presentation again with our contact details. I wonder if for our next meeting we should have like the Jeopardy music playing, something in the background. Okay, so another question. Who can I reach out to about participation in groups, as well as discussing the list of approved vendors? So for participation interest in a work group, just shoot us an email at the email box evv@dhw.idaho.gov. When you reach out, please let us know if you are a provider agency or if you're a member or an advocate, or what your engagement with this project is. And if you also could let us know what area of the state you're from. If you're a provider agency, I think the size of your agency would help, even if it's I'm a tiny agency, very large entity. And again, the reason for us asking is we want to make sure we have a pretty good distribution of demographics as part of representation on those groups. As far as the list of approved vendors, you can include that information in your email, but we will not have a response on that at this time. As of right now, you know, we are very, very much in our infancy of starting our conversations with SandData, the company that will be our aggregator. And we know that SandData has worked with EVV platforms in other states that have elected SandData as their aggregator solution. But because we have not started that implementation here, we don't know who those approved vendors might be. But if you have ideas or thoughts on how we might present that information, or maybe make it easy for providers to identify, please do share that. We are absolutely all ears. Any other questions? Oh, I happen to see a feature in WebEx that I never had noticed before that might help as well, because I know it takes folks a little while to type out those questions. I think if you mouse over your name in the participant list, you can click raise hand. It's a hand image. So I'm not sure if that just alerts me as the meeting facilitator that you're working on a question. Sarah, maybe that's something we could test for our next meeting and maybe get a screenshot of that so that folks know, hey, I have a question, give me a few minutes to write my question out. Okay, I don't see any additional questions in the chat box yet. I'm saying my goodbye slowly so that if anybody else has a question, they've got a chance. Okay, I don't see anything else, and I do see a few folks are hopping off the call. So thank you very much for joining us today. Again, please do stay in touch. Look forward to our February stakeholder update because I think we will have a lot to share. In the interim, again, please do visit our webpage and keep an eye on your emails. If you have peers, colleagues, etc., that are not receiving emails, have them shoot us an email to be added to our distribution list. We're happy to add other folks that might be interested. If we don't already have their email on file, we can certainly add them. That is no problem. So thank you, everyone. Happy holidays, and we will be in touch.